So hello everyone, myself Saravana Priyesh studying final year BDS in Chettinad Dental College. So today I am going to talk about pit and fissure sealants and preventive resin restorations. So nowadays dental care is one of the most common oral disease, especially among children and young adults. The pit and fissure of posterior teeth are highly prone to caries because they easily trap food, debris and bacteria, making them difficult to clean without routine brushing. So to prevent the occlusal caries, two important methods are used: pit and fissure sealants and preventive resin restorations, commonly called as PRR. So pit and fissure sealants. A pit and fissure sealant is defined as a resin material applied to the occlusal surface of the posterior teeth to seal deep pit and fissure to prevent dental caries. So sealant can be classified into based on the polymerization, self-cure sealants and light cure sealants, based on the filler content, filled sealant and unfilled sealant, and based on the fluoride releasing sealants and non-fluoride sealants. So procedure for the sealant application is: first the tooth surface is cleaned using pumice and a brush. Next, then proper isolation is done using rubber dam or cotton rolls. Next step is etching. So where 37% phosphoric acid is applied for about 15 to 20 seconds. This is followed by washing and drying until a clean chalky white appearance is seen. Then the sealant is applied into the pit and fissure, and light cure for about 20 to 40 seconds is done. So final evaluation sealant for retention occlusal check. So advantages are: sealant may be advantageous, they prevent occlusal caries, are conservative, painless and cost effective, and provide long term protection. And however, they also have disadvantages such as they are moisture sensitive and a technique sensitive technique, and may undergo loss over time and may require regular follow-up. Next is the preventive resin restoration, also known as PRR. So preventive resin restoration is defined as a conservative procedure where incipient caries are removed, restored with composite resin, and the remaining fissures are sealed. So PRR is classified into three types. So type A, lesion limited to enamel, and type B, small lesion extending into the dentin, and type C, large dentinal lesion requiring a base or a liner. Procedure for PRS is: the isolation is achieved by using the rubber dam, and next the conservative cavity preparation is done using small round bar, followed by removal of the infected dentin only. Next is the etching is performed and bonding agent is applied. Then the caries is restored with the composite resin and remaining fissures are sealed. So finally finishing and polishing is done and occlusal is checked. So advantages are and PRR are: it requires minimal tooth preparation and preserve healthy tooth structure, provide excellent aesthetics, and ensure good retention and helps prevent future caries. So disadvantages are technique sensitive, require strict moisture control, and it is more costly than the sealant. So I conclude by saying that both pit and fissure and preventive resin restorations play a vital role in the modern dentistry. So it helps in early prevention of the dental caries, preservation of the tooth structure, maintenance of long-term and oral health. Thus, these minimal invasive procedures are essential tool in preventing conservative dental care. So thank you.